Ladies, guys out there, how many times have you looked in the mirror, you see that annoying bump or the redness? Believe me, I know. It is called acne, and I'm sure you have thought you wouldn't have to deal with it anymore after you got out of your teens, right? Not so in many cases. Here to give us some more information on acne is certified plastic surgeon nurse Karen Nichols from Center Yourself Medical Spa. Thank you so much for joining us today.
Thank you, Alicia.
Well, as we're talking about here, you know, I've actually dealt with a lot of acne in my life, and it really is something that doesn't just affect teenagers. It can affect pretty much anybody.
Correct. It can affect women and men at even in their up into their adult ages. And it's pretty difficult to treat sometimes, depending on, you know, how severe it can be. So,
well, you're talking about severity. Are there different kinds of severity, and what kind of treatments go for those things?
There are different severities. There can be mild to moderate, and then more severe. Mild and moderate, you can use a lot of topical medications. There's basically, we're going to talk a little bit about some light therapy that can be used. When it becomes a little bit more severe, it's a little bit more difficult, and medications, sometimes oral medications, things like that are needed as well.
Well, yeah, a lot of people wonder, actually, what's the difference between acne and pimples? Is there a definition or something we could know what actually is acne?
Well, acne comes from a term, the P. acnes bacteria, and that's where the term acne came from.
Okay.
And basically what it is that it's an inflammation. It's caused from an irritation, usually in the follicle of that of a gland in the skin, in certain areas, the face, the neck, the back, the shoulders, different areas on the body.
Well, you know what? I was told when I actually went for treatments when I began with all of this that certain foods might be able to trigger acne or make it worse, like chocolate. A lot of people have heard.
Right.
We know I'm guilty. I'm not even going to pretend. Is this true?
You know, it's really not. Traditionally that's a myth. You know, they talk about greasy foods and things like that had caused acne. It's basically more that if you consume large doses, I guess that could be it. But most of the time it's a genetic factor. You know, hormonal changes, things like that really is what's causing acne.
So what you're telling me is eat more chocolate, Alicia.
Well,
go ahead.
Absolutely, because even chocolate's an antioxidant. I mean, in small doses, we talk about everything in small doses can be beneficial for us, a healthy diet, healthy foods that you're eating as well.
So what are some of the best treatments for acne that you have out there?
Well, I mean, like we had spoken about earlier, there's some topical products, you know, the benzoyl peroxides, there's retinol products or retinoids, exfoliants that way. Those are really good things to work on the skin. Facials, you can do facials at home. You can go into a salon or spa, the med spas, things like that.
Now, I'm looking at the bottom of this list that you've given us. Thank you so much for that. And at the bottom, you say something called blue light therapy. What exactly is that? We've got a pretty much demonstration here. Tell us what's going on with this.
Well, blue light therapy, they've looked in the specialty of light therapy, and what's happening here is this individual has more moderate to mild acne, and the light therapy will decrease or kill the bacteria that is causing acne, and that's what this is trying to do. You can be done about twice a week, 15 to 20 minutes, or once a week, about 45 minutes, real comfortable. You just lay right under that light and with some music, headphones.
And something real simple out there, I was always told, keep your face washed, take good care of it. Something simple that we can just throw out there for everybody they can start doing today.
Correct. I mean, probably just what you said. You look for a product that's not too abrasive, something that's going to cleanse the skin well, you know, keeping the skin clean in that aspect.
Perfect. Good stuff. Well, thank you so much for coming in, Karen. Thank you so much for bringing in all that great examples. It was really helpful.
Thanks for having me.
Good to see you.